have a feeling that Senator runs a tight meeting?
Hey, I try my best, Tim. I try my best. So my clock says 5:30. Is that what everybody else's says as well? Okay.
Yep.
Great.
Yes.
All right. Well, welcome everybody. And I'm going to go ahead and we do have a quorum. I can tell by the number of Brady Bunch pods I have on my screen that we do now have a quorum. So this will be the authority's first use of an all virtual. Hey, Sharon, how are you? An all virtual format. It's being conducted in accordance with 2.2-3708.3 of the state code, which went into effect on September 1st of this year. The meeting is being recorded, and both the recording and the draft minutes will be posted to the website. All board members are requested to please turn their cameras on if possible. Members of the public who would like to speak during the public comments are requested to place their name in the chat area, and they will be recognized in the order of their names that were submitted. Written public comments can also be written into the chat. Now, as I said before, a quorum is established, and we can go ahead and at this point, the September 7 minutes were circulated by email and made available online. Is there a motion to adopt the minutes from September 7th?
Malcolm.
Okay, we have a motion.
This is Commissioner Jim Holland, offer motion and/or second.
Okay, I have a motion from Mr. Holland. Do I have a second?
Tim Spencer from Roanoke will second.
I have a motion and a second. All in favor, say aye.
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 Any opposed? So that motion carries. I'd like to welcome everyone to this meeting. I'm so glad that we're able to meet this way. It's certainly more convenient for many of us to do this, and I appreciate everyone's time this evening to do it at this late hour. Since the last meeting, there's been significant amount of change in our office. We've had some positive movement. I know Tony's been working hard, and I think he'll introduce some of the folks that he's been having join our team, and I know that everyone's very excited about them all. One thing that I'm excited about is that we have a new board member here with us this evening, and that's Mike Tillum. And Mike, if you could just wave. I know Mike's very excited. I talked to him a couple of weeks ago after the governor made that appointment. He's very excited. He will be representing the addiction community, I think, and himself, and he is going to add a lot to this authority, and we can't be happier to have you on board, Mike, and welcome. Glad to have you, and we look forward to making some great things happen with your help. So thank you. Thanks for being here. Yep.
Thank you so much.
At this time, this meeting was called to consider a very time-sensitive policy matter that we have, and if it's okay with everyone, I'm going to go ahead and kick it off to our illustrious leader, our executive director, Tony McDowell, and he's going to give us an update of what's happening in the office, and then he can talk about some of the new business that he has before us this evening.
Well, thank you, Mr. Chairman, Senator Pillion, I appreciate that. It is kind of exciting to be able to navigate through the virtual meeting. This is my first webinar. So, you know, back in the fire department, if you did something big for the first time, you had to buy ice cream for everybody. So I guess I owe everyone ice cream at this point. I do have a quick PowerPoint that I wanted to share with everybody to go through a few items. And so hopefully what you're seeing right now is a PowerPoint presentation that says Opioid Abatement Authority. Do you guys see that?
Not yet. No.
Not yet. Tony,
Let me try the
share screen.
Yeah, it's
If it's not working, Tim Spencer probably has something to do with it.
Adam, can you walk down the hall and maybe help him?
Hey, I resemble that remark, Craig.
problem is I have two screens now, so I'm making sure I'm sharing the right one. Do you see it? There it goes.
Oh,
I forgot to hit
there
that.
you go.
I didn't hit the share button.
Oh.
So pretty soon we'll have our admin here. hopefully this sort of thing will go a little bit smoother. So again, welcome everyone. I just want to give you an update on where we are with settlements. We're looking at about almost $117 million that have come to Virginia so far this year from the 2 national settlements. 2 payments came through from the distributors to about 43.7 million total, and then 72.8 million from the Janssen settlement. And we call that the balloon payment because the first 4 years of that were all paid up front in the first year. And then years 2, 3, and 4, there'll be no payments. The payments will resume, as you all know, in year 5. Of the 116.6 million that has come to the Commonwealth, 60.1 million has come to the Opioid Abatement Authority. And so these are funds that we actually have now to our name. Just over 24.3 million has gone out directly to the cities and counties already. So this is not counting the money that you as a board will allocate to cities and counties. So they've already gotten this money deposited in their accounts. 23.4 million to the Commonwealth of Virginia, which is, again, this is not money that comes to the Opioid Abatement Authority. It's money that's gone directly to the Commonwealth and is being held in the Attorney General's Trust Fund until the end of the year. And 8.2 million set aside. This is funding from the locality's share that's held aside in a deficiency fund to cover any legal expenses that go above and beyond what is expected. And then at some point, any of those funds that are unused will be remitted back to the cities and counties to which they are owed. So just a few updates, and the senator mentioned a couple of these. Adam, if you will, please, if you could raise your hand for the crowd, I'll introduce Adam to the board. Adam is our Director of Finance. He started with us, I guess today is his 2-week mark that he's been with the authority. And he comes to us from the Senate Finance Committee, where he worked for 7 years, and then he worked for Henrico County for 10 years before that. And yes, Adam and I did know each other, but we never worked together in Henrico. We knew of each other, but this is kind of cool to have a chance to get to know him and work more closely with him here at the authority. Our next employee starts tomorrow. Charlie Linticum will be our Director of Operations and will manage the grant cycles. And so we'll see him here tomorrow morning at 9 a.m. And we have offered, and Kara Mosan has accepted the offer to be our administrative staff specialist. Kara is currently with the state police and will be joining us on November 10th. And we're very excited to have these additional folks come on board, since Adam and I are kind of, some days we're running around like our hair's on fire or something. We're also excited that we were able to execute a lease for our new office space at 701 East Franklin Street. Our move-in date is no later than next Tuesday, and we think we may actually be moving in one day this week, depending on just a few final things that they're trying to finalize. And then I've had a couple folks ask me about the grants committee, and I want to apologize that I've not been able to provide Senator Pillion with the next steps on that yet. But basically, we want to provide you with, or I need to provide the senator with a suggested scope of services or scope of work that committee would work on, and a schedule of meetings and some other details that he needs in order to come up with the next steps for the grants committee. And so I owe that to him, and I told him last week that I would be, he asked me about it, and I told him that it will be getting that information to him this week, and we'll follow through on that. You're going to hear in a moment about the listening sessions that we're putting together, as well as upcoming board meetings, and when and how we're going to launch the application process for cities and counties to begin to receive their funds. You'll also notice that we have someone joining us on the call. I don't know if you can see your Brady Bunch screen, but the young lady who's in this photo, the second from the left, Hala Najim, is going to be coming to work for the Opioid Abatement Authority as an intern. But I want to tell you just a moment about all of the folks that you see in this picture with who are standing there with Adam and me. These are 4 of the 10 Fulbright scholars who are at VCU right now participating in the State Department's Humphreys Fellowship Program. And so this is a program that includes 10 months of professional enrichment for non-degree graduate level study in the United States for accomplished mid-level professionals from designated countries across the world. So this is a program put together by the State Department. The folks that are in this picture, if I can just give you a quick update on why I'm including this, all 4 of them came and met with Adam and me last week. They're interested in learning more about what this board is doing, what the Opioid Abatement Authority is doing, and how we're hoping to improve public health, public safety in the Commonwealth of Virginia by mitigating and abating the opioid epidemic. And I think each of them has expressed some level of interest in getting involved. But Hala has actually applied and has been accepted to come work for us in an internship. But you may see any of these 4 folks around our office. The lady all the way to the left of the screen is Alabasaya, and she's from Nigeria. And she is she's a public health specialist. She has a master's degree in public health with a concentration in health promotion and community health. And she's a senior programs associate. I'm sorry, I'm reading my notes for Hala. Alabasaya is from Nigeria, and she holds a doctorate degree in public health, and she specializes in epidemiology and public health. She's a principal program officer in the Drug Control and Crime Prevention Office of the African Union Commission. And then you see Hala. Hala is, as I mentioned, she's a public health expert with concentrations in health promotion and community health. And she currently works as a senior programs associate at the Mentor Arabia Foundation, where she designs, develops, and implements evidence-based programs across the Middle East and North Africa. And as part of this fellowship, she's helping to enhance her skills in conducting effective public health campaigns, grant writing, leadership, and public speaking. She and I were chatting today, and the work that she's planning to do for the Opioid Abatement Authority includes working with community service boards and behavioral health authorities across Virginia to identify model addiction treatment programs that we can share with various cities and counties across the Commonwealth that they could implement using OAA grant funds. And so that's going to be a really important job that she performs. And then in the picture, you see my ugly mug, you see Adam, and then the next young lady is Basak Unable, who's from Turkey. She's a physician who specializes in addiction medicine. She's a psychiatrist at the Aaron Mental Health and Neurological Disease Training and Research Hospital, and is the founder and director of a rehab center for people with substance use disorders in Istanbul. And finally, on the right of your screen, you see Jean-Michel Laramorene, who's from Rwanda, and he is a clinician who specializes in neuropsychiatric disorders. He works at a teaching hospital as a mental health nurse and director of the psychotherapeutic center, and provides clinical services to patients with PTSD and substance use issues. And so I just wanted to share that because it's really exciting to see these folks. I told them that I had never met a Fulbright scholar, and I met 4 of them all at once in our office. And so I think it speaks to the importance of our shared mission that these young professionals want to be a part of what we're doing. And so we're excited to welcome them aboard. And so if I can, Mr. Chairman, I'd like to give Hala just a chance to say hello to the group.
Please, love to hear from her. Go ahead, Hala.
Good evening, everyone. Thank you for having me. Thank you, Tony, for this opportunity. I'm looking forward to be working with Tony and with the Opioid Abatement Authority, and I hope to put my expertise into perspective in the next couple of months. So thank you very much for having me, and I look forward to collaborating with Tony and the team.
Well, thank you, Hala. We're thrilled to have you. Tony's been excited about it, and Adam as well. We couldn't be happier to have you on board. So we look forward to working with you as well.
Hala's not going to let the other 3 get away. She's going to make sure that they. I think there's, if I understand correctly, I believe that there's also some interest by some of your counterparts to work at the Virginia Foundation for Healthy Youth, which is a closely allied organization for us. And in fact, they're in the same building that we're going to be in. So.
Exactly. I'm still advocating. I'm still working on on my skills, advocacy skills, to get them to OA, hopefully.
That'll be your first test. That'll be your first test.
Exactly.
So just moving on, some recent events, activities that we've had the chance to get involved with. We've been working closely with the Virginia Association of Community Services Boards. And for example, I was able to work with their executive director, Jennifer Faison, to offer a webinar, a live webinar with all the members of the Virginia Association of CSBs. And they recorded that and posted it on their website, shared it with their members. We're actually partnering with the Virginia Association of CSBs to co-sponsor the series of statewide listening sessions. Now, I mentioned this to the board more recently, but basically we're going to offer at least one session in each of the 5 community service board regions of the state, where we introduce the Opioid Abatement Authority and provide an opportunity for stakeholders, local clinicians, state family members, people from the community, from organizations to come and to share with us their ideas, their concerns, and their thoughts. And I'll give you more about that in just a moment. A number of presentations, webinars that have been done over the last month or so to the organizations that are listed on your screen, a couple of news interviews, and I'm kind of excited that I've made introductions along with Adam with our counterparts in Colorado, Tennessee, Kentucky, and we're now lined up to meet the folks from North Carolina. And so there's a lot of interest in these different statewide opioid abatement offices in collaborating and making sure that we're kind of helping each other out, and that none of us is falling behind in terms of where we are with rolling out our efforts and trying to learn from each other's efforts. And so I believe that Sheriff Barron has a question.
Go ahead, Sheriff Barron.
Yeah, not a question so much as just to the board that Tony did a fabulous job doing a presentation to the Virginia Sheriff's Association annual conference. I was there, and he garnered a lot of interest from sheriffs from across the Commonwealth and what he was talking about. And I think he made some connections there. And I just wanted to say thank you to Tony for taking the time to come down to Virginia Beach to make that happen.
Thank you, Sheriff. So some upcoming events, and for the board members, I will share all this with you in a separate email, but we're looking at December 1st to meet in Roanoke to conduct both a board meeting. We need to get in, we're required by our bylaws to conduct an annual election of officers. And so we can do that in December during our meeting, December 1st. And then that'll start at 6:30, and hopefully the board meeting doesn't last more than 30-45 minutes, and then we can launch directly into our first listening session. The next listening session will just be 2 days later in Fairfax on December 3rd. And I should mention that it's not necessary for all the board members to attend all the listening sessions. And there's no requirement for us to have a quorum, because we're not going to be taking votes on any business at these sessions. But certainly you have the opportunity to attend any of these in person, as well as to join in the virtual session. It's going to be held in January. So in January, we're looking at doing 2 sessions. One will be virtual. The second one will occur on on January 30th, and that will be held in Richmond. And I'm excited to announce that something just came together this afternoon. In fact, it's not even on my presentation I'm sharing with you, is that we're going to be working with the Virginia Association of Counties and with VML to announce the launch of our grants process for cities and counties, and to provide a workshop to provide information, answer questions, provide explanations of how to apply for the attendees of the VACO and VML local government day during the General Assembly session on the afternoon of January 19th. So January 19th at the Omni Hotel in Richmond, we will have the opportunity, the senator or his designee, to speak as a keynote during the lunch presentation. And then we'll have all afternoon with the attendees from the Virginia Association of Counties, Virginia Municipal League, to show them how they can apply for their grants from the OA. The next listening session will be in February. We have not determined a date yet. We're close to narrowing that down. We're aiming for Hampton, March 21st, another board meeting and listening session in Charlottesville. And then finally in April, we want to go back to Southwestern Virginia. We're starting out in December in Roanoke, but as everyone knows, this part of the state is geographically the largest of the 5 CSB statewide regions. The DBHDS regions. This is the largest DBHDS region, and an area where we realize there's a lot of rural communities and a lot of interest in participating in listening sessions. And so we'll have our second session for that particular region in April, and that will be in the Wise area. So that's just kind of a sneak peek about the presentations that are planned, the listening sessions and meetings that are planned over the next few months. So it's going to be certainly a very active and busy time for the Opioid Abatement Authority, but just critical for us to get the word out to the communities that we're here to serve and to help them connect these opioid abatement funds that they're receiving with opportunities to provide new services and programs. And then finally, just again, the discussion of how we're going to launch the application process. This is focusing on the funds that the board can allocate directly to cities and counties. This is what we're calling a reserved amount of funds that are available to cities and counties, because they know from formula pretty much exactly how much they're owed each year or how much they're entitled to, the 15% of the OAA funds that go to localities. And so this one-day kickoff workshop will occur, as I mentioned, on January 19th in the afternoon. We had talked about a morning session, but this is going to be in the afternoon. And then the next day on the 20th, we're looking at having a workshop that morning where we will provide some best practices and bring in some additional guest speakers to share success stories from around the state. And we will then provide a similar type of education session about the grants and how localities can apply for the grants in a webinar that we'll provide, so that folks that weren't able to attend in person to Richmond will be able to view it online and get the same information. What we would like to propose to the board is that we get to a point where these particular awards, the awards that go directly to cities and counties of the funds that they're entitled to, would be made on a rolling basis with certain criteria that the board has shared with the staff, so that in some cases we can approve applications directly, or in some cases we may need to come back to the board to get specific votes of approval from the board. The whole idea here is to get the money out quickly to localities based on what's in the statute and what's available under the statewide distribution or settlement allocation MOU. So now that that's kind of giving you guys a lot of information, I'll be happy to try to answer any questions about that. We do think that the application process for the regional awards and for state agency grant awards will happen a little bit later. We're putting March as a placeholder. We'll have to reevaluate that. Our goal right now is going to be to get the application process for cities and counties launched by January 19th, and then we'll immediately pivot to open up applications for the regional partnerships and for the state agencies by March. And so, Mr. Chairman, I'd like to just pause here for a moment and with your indulgence to see if there's any questions from members of the board before we continue.
Does anybody on the board have any questions? If on the authority, if you can just raise your hand, we'll recognize you if you have any concern, any questions about his presentation. Obviously, they've been very busy since we last met, and we certainly appreciate his enthusiasm in getting this money out the door. That's what we've all expressed, that we wanted to make sure that this money didn't just sit there, that it got to the communities that needed it the most. So if anybody has any questions for Tony, now would be a great time.
Senator Pillion, there is a question in the chat from someone, Tricia Christensen, for Tony. How will you be selecting guest speakers for the workshop? Can organizations reach out to be considered?
Yes, ma'am. It's a great question. Absolutely. I would encourage anybody that's listening online or who receives a copy of the minutes for this or watches the recording to simply reach out to me. tmcdowell@voaa.us. Put that in the chat. I think it was in the invite as well, and share that information, and I can be in touch, and we can certainly discuss what type of presentations we're looking to have during the workshop and consider some different opportunities. Absolutely. Mr. Chairman, that's all I have as the executive director's report.
Okay. Any questions for Tony from anyone before we move on? Again, Tony, thanks for your hard work. Appreciate it. You and Adam, and I know we've spoken a lot, and I appreciate that. And you've got you've gotten a lot accomplished in a very short time period, and the next few months are going to be very, very busy. I'm planning on attending every listening session that I can and across the state. And Jason Ballard, I know Delegate Ballard will be there at many of them too, especially in and around Richmond during session. But I would like to encourage everyone to be at as many as possible. I think that's how we're going to learn where these grants really could be utilized and could be can make the most benefit to their communities that we are awarding them to. If no questions, I guess we're moving on now to new business. And Tony, I'm gonna kick it back to you. I know we've got a policy that we've been discussing. I think Tim's been working on this with you. Is that correct? Yeah. And to incentivize some cities and counties to use and report direct disbursements from the opioid settlements by meeting the OAA gold standard. And I'll kick it to you, and Tim may want to add some comments to this as well. Go ahead, Tony.
Yes, sir. Thank you. Going back to sharing the screen, you should see a slide that says proposed incentive policy.
Got it.
Perfect. Okay. So let me just start off with a quick review of some background. By statute, this authority must reserve 15% of its fund each year to be distributed to the participating subdivisions, which means cities and counties. And then the statewide settlement allocation MOU, the agreement with the Commonwealth and all the cities and counties agreed to, further delineates the percentages that go to each city and county. And so again, we have a fixed amount that's known that each city and each county is essentially entitled to receive, as long as they propose a project that we feel that this board feels meets the intent of the settlement, basically that it deals with opioid abatement remediation. In addition to that 15%, the board does have the option to award additional amounts in its discretion. 15% is required by statute. So when the OAA looks at providing these funds, there are certain statutory requirements on those funds. So only efforts that are conducted or managed by either a state agency or by one of the participating cities or counties can be funded. So we can't give grants to private organizations. We can't even give grants to nonprofits, but instead the grants have to be given to a city, to a county, to a state agency. 100% of the funds have to be dedicated to the abatement efforts. Organizations cannot supplant existing funding, and there are no indirect costs allowed. And ultimately, each recipient has to provide the authority with certain types of information, including their expenditures, the outcomes and results, and they have to allow the authority to monitor the ongoing efforts. By comparison, cities and counties are receiving afraid we're missing a slide. If I could direct your attention to the proposed policy. And this was distributed with the minutes that was posted to the website, and I'll bring that up. I apologize. Bear with me. Are you able to see a screen that says draft policy to incentivize cities and counties? Okay.
Yes.
This is the draft policy. And it's, excuse me, it starts off explaining those statutory obligations that I just reviewed to you. And then it says, in addition to receiving the opioid abatement authority's distribution, each participating city and county also receives distributions directly from the settling companies. And so this is the 30% of funds that come to the Commonwealth that go directly to the cities and counties. And cities and counties are responsible for using these funds and reporting the requirements in accordance with the national settlement agreement and not by state statute. In other words, the statute only applies to the funds that are distributed by the authority and not the funds that are distributed directly to the cities and counties by the settling companies. And so what that means is that cities and counties have two different sets of standards that they have to meet. Or potentially, they have the standards that are put out by the National Settlement Agreement, by the National Agreement, which is governed by, really it's judicially monitored since that agreement is incorporated into a court order. And so as they spend these direct settlement funds, they don't have to report how those funds are being spent to the Opioid Abatement Authority or to any state entity, but they are sort of liable for how they spend those funds to the court that's overseeing the administration of those settlements. And the uses of those funds and the limitations of those funds are really not very clearly defined in that national settlement agreement. So for example, are cities and counties allowed to supplant those funds? It's not really addressed in the agreement one way or the other. Are they allowed to collect indirect costs? Again, it's not really clearly defined in the agreement. And then there's questions about whether they have to spend the funds on abatement at all. And this is where the national agreement has some language in it that makes it maybe not as clear as what the state statute has in place in terms of governing the use of Opioid Abatement Authority funds. And so the proposed policy is that for each city and county, that we would propose that each city and county meet the requirements that are in place for the Opioid Abatement Authority funds, which we're calling the gold standard, the no supplanting, 100% has to be spent on abatement, no indirect charges, that they would apply those same standards to the funds that they're getting directly from the settling companies. And they would report their expenditures to the Opioid Abatement Authority and allow us to inspect the work that they're doing and to hear about the outcomes and results that they're having from those projects and those efforts. In other words, they would treat all their opioid settlement funds the same, whether they're coming directly from the settling company or coming from the Opioid Abatement Authority. And it really would mean that they're meeting the highest possible standard. They're meeting the gold standard across the board. And if they would be willing to do that, then the Opioid Abatement Authority in turn would be willing to increase their share, their 15% that they're getting. We would increase their share by 25% for each year that they agree to meet our standards. So I'm going to stop here for just a moment and ask Tim if he would like to expand on any of what I just shared with you.
Just real quickly, Tony, and it's going to be by way of question. If we can go to bullet number 1, which in many ways sets out the gold standard, the fund's efforts designed to treat, prevent, or reduce opioid use, disorder, or the misuse of opioids through evidence-based or evidence-informed methods, programs, or strategies. Real quickly, just want to clarify that this is part of the toolbox that you're talking about, correct?
Yes, it is.
And this is, you mentioned earlier that on January 19th, you've just found out that you're going to do a joint presentation with VML and with VACO on Legislators Day, correct?
That's correct.
And that'll help educate localities on how they can participate in this, correct?
Yes, sir, absolutely.
What else can you add about clarifying and having some of these off-the-shelf programs that would be readily approvable?
So in many cases, we have cities and counties that already have programs in place that they're currently operating that they may be seeking to expand. And many of those are evidence-based programs. They may meet standards of the American Society of Addiction Medicine. Dr. Thompson is with us tonight on the board. He actually is the president of the Virginia chapter of ASAM. And so that would be those types of programs. I would suggest as we finalize the criteria that we're going to use could be, I mean, we could say that there's prima facie evidence to show that those are programs that would meet this criteria. Similarly, programs that meet certain existing state standards could be considered as having met our standards. And then as the efforts that HALA is working on begin to bear fruit and we're able to add additional programs to the toolbox that are evidence-based, that have a record of success, that this board, the grants committee can look at and give a seal of approval, then a locality could simply take that program and tell us that that's what they intend to implement and we could approve those very quickly as a result of that.
And in fact, aren't you even thinking about having certain programs that'll be pre-approved?
Yeah, exactly. So certain programs, particularly those that, as I mentioned, as an example, if a program had been has been certified by American Society of Addiction Medicine, and VASAM gives us that seal of approval, then I would suggest that's the type of thing that this board could pre-approve. We want to be really careful about getting into the business of endorsing programs, but I think if there are certifications, if there are designations, there are professional accreditations that are out there that organizations could submit their programs to receive, for example, ASAM certification, that's recognized by Medicare and by Medicaid, then I think then that gives this board the ability to provide some good housekeeping seal of approval, if you will. Not necessarily an endorsement of the program per se, but prima facie evidence that it meets the intent of the statute.
Well, thank you. I appreciate answering those questions.
And so, Mr. Chairman, I don't know how unclear that may have been for members of the board. We are pretty excited about the idea of proposing this incentive because it gives each locality the opportunity to draw down additional funds and to make sure that they're applying a gold standard to all of their opioid funds, which in turn would allow Opioid Abatement Authority to really take a look statewide at where we are with addressing this epidemic and to make sure that we're meeting the intent, not just of the statute that we're operating under, but the intent of what I think the General Assembly and the administration is looking for in terms of an annual report where we can demonstrate progress. We would ask the localities to agree to certain terms and conditions that would go with any distribution of awards. So these would apply for any locality that's seeking to draw down its share from the Opioid Abatement Authority, but it's not anything that would be a surprise. I think it's all conditions that localities would expect to see on funds coming from the state. There's going to be certain forms that they're going to have to submit or fill out. We might have a software portal that they would be asked to use. They would need to provide certain types of basic information about their proposal. We would have to determine whether their proposal is something that we would pay up front or we would pay them on a reimbursement basis. There'd have to be a time frame under which they're going to spend their funds and demonstrate performance in terms of outcomes. We would have to identify types of expenses that maybe aren't allowable. So, for example, are we going to allow certain types of travel expenses? We're going to have to figure out the nitty gritty of that. Percentages that must be committed to opioid abatement. And so an example of that is if a locality wants to do crisis intervention training for police officers, that includes training on how to deal with someone who's going through opioid withdrawal, but there's other elements of that program that maybe don't have as much to do with opioid addiction. And so we'd have to decide how much of that training program would have to be committed towards allowable expenses. And so we'd have to figure some of those details out. We'd also have to make sure that we define and give examples of what supplanting is, what constitutes indirect charges, and so forth. And ultimately, we're going to need to be able to audit how the audit's probably too strong of a word. We need to be able to see the audits that localities are already required to conduct, and then possibly spot check how they're spending their OAA funds, particularly if there's a question about the expenditures, that they are willing to participate in reviewing that with us on the back end. And then ultimately, before a locality voluntarily agrees to apply the gold standard across the board and to receive their opioid abatement incentive, then we would need to figure out what those payment terms look like, because the payment that they're getting directly from the settling companies doesn't come from the Opioid Abatement Authority. And so we'll have to figure out what those payment terms look like for the incentive, the time frames for performance, and how we would handle any non-performance as it relates to funds that were provided to them through the direct distribution. And so there's certainly some terms and conditions that we'll have to present to the board for approval if the board wants to move forward with developing this policy. So I think that Mr. Chair, the question tonight is whether or not the board is comfortable approving the policy. The policy would be contingent on finalizing the terms and conditions, which the staff through our council will come back to the board at a later date to finalize.
Before we do that, does anybody have any questions? I know this is a lot of information to take in, but I think it was, Tony, this was distributed to us prior to the meeting, correct? Everyone should have received a copy of this in their agenda.
Yes, sir. It was attached to the email and it's attached to.
Perfect. Okay. Before we go any further, does anyone have any questions for Tony or Tim for that matter? I know Tim's been involved in this too.
Mr. Chairman, this is Jim Holland.
Go ahead, Jim.
Yeah, one question I have is, and I know it's far easier, and I agree because Tony has mentioned this before, but do we have the authority to mandate that they report to us, even though it's non-OAA funds, such as directly from the Attorney General? Have we discussed that with that department, Tony, the legality of that?
Yes, sir. We spoke with the litigators that are working on this from the Attorney General's office, and well, James is on the call. I can ask James if he wants to offer any comments, but in short, they have no concerns about it.
Thank you, Mr. Chairman. Thanks, Tony. Yeah, just to piggyback on top of what Tony has stated, my colleagues that are handling litigation have talked about this. The purpose of the gold standard, as Tony has outlined, is to encourage or incentivize the localities to provide information to us voluntarily with respect to are they required to give us the information on what they do with the direct distributions. We can make those contingent on the grants and awards and loans that we provide to the localities as well, but we were hoping that we could use the carrot rather than the stick.
Okay. Yeah, thanks for that clarity. And the other point is, I know you're working on policies, and Adam are working on policies in terms of reporting requirements, the timing thereof, and also the annual reporting that this authority is required to provide to the governor and General Assembly as well. And so I know you all are working on all of those things, as well as how we will invest funds that are not distributed and or used currently. And lastly, a comment too, Tony, to you and Adam in regards to eventually revising our budget. As you know, we had a budget presented and approved. We'll need to revise that with our upcoming costs, especially Attorney General and other costs associated with administration. Thank you.
Yes, sir. Mr. Holland, if I may, Mr. Chairman, the comment about the statewide reporting. If we took no action and we as authority only focused on the 55% of the funds that this board's going to distribute, and we only reported the results that occur as a result of that 55% of the fund, then I feel that the general public, the General Assembly, the administration is missing out on information that is relevant because of so many funds going through direct distribution to the cities and counties. And so this is sort of seen as a win-win, that it puts more money into the cities and counties to carry out their programs and provides more information that the OAA can assemble and that we can combine into that report and share back with the policymakers.
Thank you.
Anyone else have any questions? And Dr. Thompson, my apologies for welcome on. I know you've been here the whole time, but glad to see your face in there. So
thank you. I ended up in the wrong category or something like that, but I've been here. Thanks.
And thanks, Adam, for helping him.
Thank you, Adam.
Well, since there's no other questions, I think that the time is now to, if we can entertain a motion. I don't know whatever the pleasure of the authority is at this moment, but if anyone would like to put a motion forward, we'd love to entertain that.
If I could move for, Mr. Chairman, for approval of the draft policy substantially in the form attached to our agenda.
All right, I'll take that a motion to adopt the draft policy that was attached to our agenda. Do I have a second?
I'll second that motion.
All right, we have a motion and a second. All in favor, please say aye.
Aye.
All opposed? So that motion carries to adopt the draft policy to incentivize cities and counties to use and report direct distributions from opioid settlements by meeting the OAA gold standard. All right. So the next portion of our agenda includes what's the most important portion, and that's public comment. And I know that we have several participants on this evening with us. And I'm going to turn it back to Tony, and he's going to provide some instructions for those attendees on how they can make the comments in the virtual setting if they so choose. So Tony.
Thank you, Mr. Chairman. So any attendees who would like to address the board are requested to enter your name in the chat function. And then I will call upon those individuals in the order in which their names appeared in the chat. And when it's your turn, you will, as a speaker, you'll be promoted to panelist, which will allow you to turn your screen on and to unmute yourself so the board can hear your comments. When you're promoted to panelist, you'll see instructions on your screen to accept that panelist role to unmute yourself. And so at this time, if there's anybody who would like to make comments to the board, I would simply ask that you put your name in the chat. Alternatively, if anybody's having a hard time finding the chat, you can press your raise the hand button as well. I just want to make sure we're not missing anyone who has comments. Seeing none, Mr. Chairman, I don't think we have anyone to make public comments.
Okay. All right. So I know that we've set the meeting date for our next meeting. That's going to be December 1st in Roanoke at 6:30. And I'm assuming, Tony, we will allow a virtual option for that as well, as long as we have a quorum in place, correct?
Yes, sir, that's correct.
Okay, so, and the location, I know that our host city liaison, Tim Spencer, will, I'm sure, tell us where we're going to be meeting that day. Have we determined a location?
Actually, Mr. Chair, because we're working with the Virginia Association of CSBs to combine this with a listening session, we're going to be meeting at one of the local community service boards, but I'm not ready
Even
to
better.
verify exactly.
Okay. All right. So December 1st at 6:30, location to be determined. Tim will be providing lemonade and cookies for everybody there, right?
If we were at the Hotel Roanoke, I could get you candied bacon.
Well, there's always that. I mean, it could be arranged, I'm sure, right? But
I think
Anyway.
we can arrange something.
all right. All right. Any further discussion or questions from the authority before we entertain a motion to adjourn? I'll just say that we are doing some great work, and we're getting ready to do some even better things. I have a feeling that our timeline is going to exponentially explode, and we're going to be really making a difference in these communities. Tony and Adam, thank you again for your leadership, and thanks everyone. Yeah, for sure. And thanks everyone for joining this evening. At this moment, I would entertain a motion to adjourn.
I make a motion to adjourn.
Thank you, Sheriff. Thank you. All right, and a second.
I'll second.
All right, thanks, Doctor.
All right.
And all in favor, say aye.
Bye.
All right.
Aye.
Have a
Aye.
great night, everyone. I hope to see you in
Good night.
Roanoke. If not before, I'll see you. And if not there, I'll see you in Richmond. Thanks so much.
Take care. Bye.
Take care.